How's everyone this morning? Day after Halloween, November 1st already. So we are talking about a very important topic. I'm Hartford HealthCare's Tina Barona, Director of Media Relations. Happy to be with all of you this morning on November 1st. And of course, we always think of open enrollment, Medicare Advantage plans, savings plans. What does it all mean? It can be a confusing time for many, and I'm joined by a couple of guests today that are going to answer all of your questions and sort everything out and make this somewhat confusing process a little bit easier for all of you today. So I'm really happy to be joined by, to my left, Marla Pantano. She's president of CarePartners of Connecticut. Welcome. And alongside her is Jessie Mejia, sales director for CarePartners of Connecticut. Welcome, Jessie. Thank you for joining us. Marla, I want to begin with you. You know, as we get older and how to stay healthy really becomes a primary focus for all of us, for many people. How important is it that the Medicare plan you choose as far as staying healthy is concerned?
No, thank you. Yes. One, first, I'm really excited to be here and to really answer questions for everyone. And help hopefully make this a simpler process. But to answer the question, really Medicare that you get when you retire from the government covers about 80% of your underlying hospital and doctor visits costs. But you still have to pay 20% of that cost out of your own pocket, and there is no limit to that. And so that can be very, you hear a lot about people becoming bankrupt or really depleting all of their savings. And so it's really important to get additional coverage on top of what your original Medicare would cover. And there's different options for that, but you want to look at that from what does it completely cover, including things like prescription drugs, dental, other things that are really important to your health. So that's really important to continue to look at that and look at what the options are, including Medicare Advantage plans.
And so, Martha, when you talk about a good Medicare plan, which is important to have, that has to provide that safety net of sorts, right? Talk a little bit about that.
Exactly. So you want to make sure that the plan that you choose is going to cover most of those costs to really protect your own financial health as well as your physical health, and that it covers the services that you need, and that you can ensure that if you do get an illness, and those are not predictable, and those are what you're really getting the plan for, is to help cover you when you are going to get sick, and you don't and ensure that you have the right amount of coverage that you can get the health care that you really need.
So let's talk about the here and now. This is open enrollment, time to make changes, time to figure out what plan is right for you, for your family. What should folks be doing right now at this point in time?
So first you want to take a look at what do you currently have? What is your current coverage? And is that really fitting your needs? And what are the other options in the marketplace? Right, so take a look. I think it's good. A lot of folks kind of, make their original decision when they first get into Medicare, and then just, kind of just keep on going along and don't really look again at the marketplace. There's a lot of changes being made, new entrants like ourselves that have come into the marketplace that may have not been there when you originally chose your coverage, and you want to take a look at that and look at what they offer, both not just from the cost of going to see your doctor, which is really important, but other things like I just said, around what's the maximum amount of pocket that you're going to have to pay in a year if you do get ill. Do you cover other supplemental benefits like dental, like hearing, vision, providing over-the-counter benefits so that you can help get you additional cover things like other medications, over-the-counter medications, other things. There's a lot of plans out there like ours that have $0 premium outside of your Part B premium that you pay to Medicare, and you can get many of those things covered.
I just want to make sure, can everybody hear Marla? Can you all hear her in the back? Okay, good. Marla, what about financial protection? Obviously that's very important to consider in a plan. Talk a little bit about that.
Right. So as I was saying, looking at, so sometimes it's confusing. What does maximum out of pocket mean? It means in any 1 year period, that's the maximum amount of money that you have to pay yourself. And after that, if you reach that amount, for all of your costs, whether it's prescription drugs or additional co-pays that you pay. Once you reach that amount, you don't have to pay anything past that. So at that point, the insurance plan covers all of that. So that really provides you that great financial protection. And we're really proud at CarePartners that has been really important to us, especially in today's, with the environment, with all inflation and everything that's really creating a lot of strain. We really invested a lot in that and have one of the lowest maximum out-of-pockets in the state, considerably lower than many of our competitors.
Let's talk about Medicare Advantage versus original Medicare. What is, I guess you could say, the advantage of Medicare Advantage?
Right, so as I was saying, Medicare itself, without a supplement plan, without any other additional coverage, only covers 80% of your hospital and doctor's costs. It does not cover prescription drugs, so you have to get a different policy for that if you don't choose a Medicare Advantage plan. And it doesn't cover other things like dental and other benefits that I've mentioned. When you get a Medicare Advantage plan, it's simple. You buy one plan, and they cover all of those benefits. You have one card, you don't have to have multiple different insurance plans. You get all of that coverage in one policy. So it really allows you, the greatest simplicity and also the greatest coverage for most people.
Let's talk about the uniqueness of this plan of, obviously, CarePartners of Connecticut is partners with Hartford HealthCare, and that's unique in and of itself. But let's talk about all of the ways that this is different than other plans that are out there, because there are many.
Exactly. So I'll mention a few, but obviously as the president of the plan, I'm very proud of the plan that we are building. And as you just mentioned, Tina, it is a partnership between what's now called Point 32 Health from Massachusetts, which is a combination of Tufts Health Plan and Harvard Pilgrim Health Plan from Massachusetts. Tufts Health Plan has a great legacy of being a very high quality plan. They just got their 8th year of 5 stars in Massachusetts, which no other plan other than one other plan in the country can claim that. We here at CarePartners, we're a new plan. We're now a 4-star plan. We're building towards that 5-star, but we're one of the few that's a 4-star plan here in the state of Connecticut. Most of our competitors actually slipped to 3-star. What does that mean? Medicare does a very thorough job of both asking current members of these health plans, what is their experience inside this health plan? How do they experience it? They also look at quality measures on the care that's being provided. And they measure us on 40 different measures. And based on that, they come up with a star rating out of 5 stars. And so we're really proud, especially when we look at specific areas. So on quality of care, like the quality of the care that you receive, we are the top-rated health plan in the state of Connecticut for quality of care. Very proud of that. And that is through this strong we do with our providers. We work very closely, hand in hand, to make sure that we're providing them information, that we're working together to really provide that. The other is that we're one of the top 2 plans on customer service. And I take that I'm very proud of that we ensure we have local folks in New England that answer all of our member services calls. And we get a lot of great feedback that people feel like when they have questions, when they have issues, that we resolve them quickly, that we're really working quickly to make sure that everyone gets the needed care that they can get.
Thanks, Marla. Jesse, I want to bring you in here. Choosing a Medicare plan can really certainly almost always be very overwhelming. What would your advice be to those out there who are trying to choose a plan or maybe choose a plan for a loved one? How do you kind of guide them through that process?
I think that's a great question, and thank you for posing that. I think we all have our own journey on how we look into Medicare. My journey started with me helping my parents figure out what's the best option for them. Some of you probably have the same situation where you ask your children to help you understand, to make sense of this. And the way I started is you got to figure out what's the right plan for you. What's the best for you, and what do you feel are your needs? One of those ways to do that is by coming to in-person sessions to better understand from licensed Medicare agents on how our plans can support your desires, your ambitions, your own healthcare needs. And if you cannot make an in-person session, you can also join us through virtual sessions that we have on Zoom. You can find information about CarePartners of Connecticut on our website by just going to carepartnersct.com, and that will provide you information in our schedule for in-person sessions and also our Zoom.
And Jesse, I would imagine a lot of it really depends on where you are in your life, right? How healthy you are, what chronic illnesses you have, or anything along those lines in terms of how you should be choosing what's right for you in terms of your medications, what you might need, sort of thinking about the year ahead. Is that right, to sort of kind of go from it at that angle?
Absolutely. Because when you start looking at what you need, it's a partnership between you and your primary care provider. And to go back to the uniqueness, Tina, we at CarePartners of Connecticut are in lockstep with your primary care provider. We are a plan built by Connecticut doctors, exclusively for Connecticut residents, so we understand your needs and we can partner and help navigate the world of Medicare insurance. So as you think that through, those are ways that we can bring value to you.
And you touched upon it briefly about ways that you engage with the community, obviously like sessions like this, and it's nice to see all of you here participating. But there are other things, you mentioned Zoom, there are other ways that you engage in the community to be there for folks when they have questions and to really help educate them. Talk a little bit about maybe more specifically what you offer.
Absolutely. So when we talk about community, it's about being present. It's about being where our members are. And with that, we also talk about language. We have a robust network of Spanish and Polish-speaking brokers that we work with, and we create collateral material in the native language of our community members. In addition to that, we also have employees who are bilingual in multiple languages that we can leverage their skills to ensure that we can meet the needs of our members in the community.
That's so important. Marla, I'm going to go back to you. Is now the time that folks should be rolling in a Medicare Advantage plan?
Yes. So as you were mentioning, Tina, that we're right now, we just started on October 15th was the beginning of enrollment for the annual enrollment period for Medicare, and that runs through December 7th. So right now is really the time to make sure, as Jesse was just mentioning, that you're really taking the time to look at your options. So don't wait till the last minute. It's best if you try to start to get that information. You can do that through enrolling in one of our online or in-person seminars, as Jesse mentioned, or you can speak to your local broker as well. Brokers also can, enroll you, look at what you need and what your different needs are, and determine together what's the best option for you.
And I think that's so important to have that discussion and that education. And Marla, for those who have existing plans maybe elsewhere, why choose CarePartners?
So again, you have to look at who your doctors are, what your medications are, and that's important. But we do offer, as Jesse was just saying, and as I mentioned earlier, I believe one of the highest quality plans in the state that offers the best financial protection for you and ensures that you can get access to the highest quality of care. So I'm very proud of that, and I really would love to offer that to more and more of our state folks that live in this state. I am a Connecticut resident I was born here and have stayed here. So I really care very much about our state and what we offer. We are also working on continuing to expand our network, and we will soon be announcing a large expansion of additional doctors that have joined that are now going to be part of our growing network. So if you've looked in the past and you haven't seen necessarily all of your doctors, I would just say in the next few weeks, take another look and you likely will find them.
Marla, you mentioned financial protection. That's obviously very key and very important to a lot of people. Talk about the financial protection aspect of this.
So it is important that we, again, that you ensure that you have the coverage that you need for all the different services that you need. So that does include, as I was mentioning earlier, the maximum out-of-pocket, what's the maximum amount you have to pay in any one year. But it also includes, the different costs for all the services. We lowered our costs on many services that you have to use frequently. So for some folks, during different times, they might need, say, some of your physical therapy. if you've gone through some event where you need that. So we lowered the copays for that to make that more affordable. Mental health and substance abuse, lower the copays for that. We know for folks sometimes when that's needed, it's something you need more than one of, you need to see somebody more than once, right? So making those copays lower so that's more affordable. So really looking at many different ways to try to make sure that we're protecting the financial, because that financial well-being is greatly tied to your physical well-being.
Yeah, very, very important. I see some of you taking down some notes, and I'm sure that you have questions, and we want to make sure that we get to your questions. Jesse, just a couple more questions for you. Is there an easy way to compare Medicare Advantage plans?
Yes. The best way to compare Medicare Advantage plans is by going online to a website called Medicare.gov. From Medicare.gov, you will find a number of plans that are rated by a system called a STAR system. The STAR system is from 1 to 5, 5 being the best. And I'm proud to say that CarePartners of Connecticut is ranked at 4 out of 5 in quality. So we are a leading plan in the state of Connecticut.
And so how does somebody actually enroll in CarePartners in the plan?
We make enrollment easy. We can do it either in person, you can go to our website, or you can come to one of our in-person sessions, and we can do it there with you as well.
Great. All right. We're going to take some questions now. Marla, Jesse, thank you. We're going to turn it over to the audience, and I'm sure there are a lot of questions. There always are. It's a very engaged audience. Anybody have right over here? All right. Let me just grab that mic, Marla. The other one. There we go. This one. Thank you. Good morning. What is your name and your question?
Good morning. My name is Paula. My question is, when you get insurance, one of the things you need to be aware of is what might not be covered. So I'm wondering if you went on vacation out of state, would you have coverage? Let's say you had an accident and you fractured a hip or something awful like that. And also, what if you move? Let's say you unexpectedly have to move out of state. What are your options in those two scenarios?
Those are great questions. So from the going on vacation and you have an unexpected event, we definitely have emergency coverage. So you're covered anywhere that you go where you need that emergency care. It's covered as in network. So there's no worries there that you can access the care that you need and make sure that you can get the health care that you need. As far as moving, if you move out of state, that would be considered by Medicare as a change event, right? That would allow you to then re-enroll in another health plan that matches your needs in the location that you go to.
Any other questions? Oh, there we go.
Do you need this?
Excuse me. Good morning, your name and your question.
Hi, I'm Fern. My question is this. I have multiple doctors in different practices, like Starling, Prime Health, blah, blah, blah.
Mm-hmm.
So if I had this insurance, would they all be on the,
health
should I
plan.
go to all of those different doctors?
Sure.
For different types?
Yes, so we do have many doctors outside of just Hartford HealthCare. I know we're partnered with Hartford HealthCare, so but our network is much broader than just Hartford HealthCare. So Starling, you mentioned them. Yes, they are part of our health plan, and that's why I was mentioning to you, particularly we're expanding and adding many more doctors right now. So in the next couple weeks, you'll be able to go out and see. I think most of them will likely be covered.
Is UConn Hospital on?
It is. It is.
All right, good for you. Good morning. What's your name and your question?
Good morning. My name is Miriam, and I have two questions.
Sure.
Is it possible to join Medicare Part D without joining C? And the second one is, how much is the additional cost to have Medicare Part D or C and D?
Sure. So you can, if you choose just a Medicare Part D plan. There will be a premium for that, and you obviously need to look into that, but there will be a cost to that on a monthly basis that you need to pay, in addition to your Part B premium that you pay to the government. Again, I don't know your exact situation. Sometimes folks are qualified for Medicare and Medicaid, and so there could be some differences there. I just wanted to qualify that you could be eligible for some subsidies. So you need to look at that specifically for your, with a broker at your own situation. So I want to be careful about what I'm saying here. But for folks that do not qualify for that subsidy, then there is an expense for that. In addition, you'd want to get a supplement policy so that you're on your other side where you have that 20% coinsurance that helps cover that cost from Medicare, plus gives you so that you don't have to pay, because that doesn't have any. If you have for example, to make up something, say you unfortunately had a cancer diagnosis, which could easily amount to in total $250,000 for a year of treatment with different medications. If you had to pay 20% of that out of your pocket with no limit, that's a lot of money. So you want to make sure that you have something to protect yourself, okay? So Part C, a Medicare Advantage plan, gives you all the benefits of Part D, all that prescription drug coverage, plus limits the amount of money you have to pay out of your own pocket. And we have $0 premium plans, meaning you don't pay anything additional. You don't have to pay another premium on top of your Part B. It's $0. So it really is important to look at those options.
Good morning. What's your name and your question?
Good morning, I'm Cassandra. So you're saying that Part C, which is Medicare Advantage, right? Because the $170 a month is B, right? Medicare B, and you've got to be enrolled in A and B first, anyways, right? Are you saying it's nothing additional for CarePartners?
We do have a $0 premium plans, both in HMO and PPO plan. There is no additional cost outside of what you're paying for Part B. And you get the prescription drug, and you get all of the other things I mentioned, dental, other supplemental benefits. And we have Eric standing over here, so after the conversation, if you'd like to ask more specific questions about your own situation, he can answer those for you.
Any other questions? No, one right up here up front. Good morning, your name and your question.
Robert, how does the coverage apply if you get ill out of state?
Yeah, so if you get ill out of state, then we do have emergency coverage so that it's covered anywhere that you are, and we make sure that you have that coverage. So it would be covered if you had an illness when you're traveling.
Do all the hospitals or physicians accept it out of state?
Yes, because as long as they accept Medicare, yes.
All right, any other questions? All right. I always like to end on a positive note. So Marla, Jesse, first of all, thank you for joining us. And just some final thoughts as we wrap up here in terms of what, obviously we talked about what folks should be doing, but just to sort of make this process a little less daunting and a little more easy, just final thoughts.
I think as you think about your own needs, take advantage of the opportunities that are present to you. We have a licensed Medicare agent here with us, so if you have specific questions, seize the moment and ask us before you leave so we can support you in your decision making.
Marla Pantano, President of CarePartners of Connecticut, and Jesse Mejia, Sales Director of CarePartners of Connecticut. Easier said than done, I guess, right? Thank you so much for joining us this morning, and thank you, of course, as always, for coming with your great questions and for taking notes. And again, they're here to answer all of your questions. So for now, I'm Hartford HealthCare's Tina Barona. We'll see you again real soon, but for now, as always, be well.